welcome to the Deep Dive. Today, we're going to cut straight into a global health challenge that, well, often operates a bit in the shadows. Non-communicable diseases. NCDs, you know. These chronic conditions, they aren't just statistics. They can profoundly impact daily life well-being.
Absolutely.
So our deep dive today, it really zeroes in on this illuminating study from Turkey. It explores that critical link between NCDs and how middle-aged and older adults are actually doing health-wise and, functionally day to day.
Right. And our mission here is really to sort of quickly pull out the key insights from this really comprehensive national study.
Sounds pretty big.
Oh, it is. It looked at data from nearly 900 people aged 45 and older. So it gives us a powerful shortcut, really, to understanding this vital public health issue and what it actually means in the real world.
Okay, so before we get into the findings, maybe just clarify, how did this study define NCDs? Like, what conditions are we actually talking about here?
Good question. So they took a broad view. NCDs were defined as these non-communicable chronic conditions. They can be caused by, genetics, physiology, environment, even lifestyle factors. They're typically long-term, slow progressing, but they can absolutely be fatal, tragically. So we're talking about cardiovascular diseases, think stroke, coronary heart disease.
The big ones.
Exactly. Diabetes, chronic respiratory conditions, cancers, but also things we might not immediately jump to, like depression and even really common musculoskeletal issues like low back problems.
It's actually kind of astonishing how pervasive they are. You hear the term NCDs, but it's easy to miss the sheer scale of the impact, isn't it?
It really is. What's truly staggering, I think, is that NCDs account for something like 74% of global deaths every year.
Wow.
Yeah, and a huge disproportionate chunk of that falls on low and middle income countries. Turkey itself, the study notes 87.5% of all deaths there are attributed to NCDs.
That's enormous.
It is. And, as populations globally are aging, fertility rates going down, people living longer, the prevalence of NCDs is just set to surge. And while they hit all age groups, the impact is really, really felt by those middle-aged and older individuals.
Leading to limitations.
Exactly. Functional limitations, reduced mobility, needing more care. It just profoundly impacts quality of life. It stops being just a medical problem, and while it quickly becomes a major societal challenge.
So this specific study in Turkey, it used data from their 2019 health survey, right, focusing on adults 45 plus living in the community. And they looked at self-perceived health, how people felt their health was right, but also these two key measures of functional independence, activities of daily living, ADLs.
Right, the basic self-care things like dressing, eating.
Yeah, exactly. And then instrumental activities of daily living, IADLs, those more complex tasks you need for living independently, like handling money or making meals.
And the findings, well, they painted a pretty stark picture of the NCD burden there. Around 20% of the people in the study reported their health as very poor or poor. 1 in 5.
Yeah. And then for daily functioning, about 4% had limited basic ADLs, those self-care tasks. But a really significant number, 25.8% over a quarter, faced limitations in the more complex IADLs.
That's quite a jump.
It is.
Wow.
And interestingly, among the most common NCDs they found, low back disorder was surprisingly high, 43.5%, along with neck disorder at 31.7% and diabetes at 21.6%.
Huh. Low back disorder that high.
Yeah, and multimorbidity, just having 2 or more NCDs, was also alarmingly common, affected 46% of people. It is kind of surprising to see those musculoskeletal issues so prevalent often gets overshadowed by, heart disease and stroke. What does that tell us about just how pervasive these NCDs are, beyond the immediately life-threatening ones?
That is a powerful point. And when they dug into the impact on how people perceive their own health, what really stood out was the effect of conditions like stroke, myocardial infarction, coronary heart disease, and having multiple conditions, multimorbidity.
Right. Those all showed the strongest link with reporting very poor or poor health. Stroke, in particular, had this exceptionally strong effect, even after they accounted for things like age, gender, lifestyle.
Which really suggests it's not just a major NCD, but maybe like a bellwether for wider functional decline, wouldn't you say?
Exactly. And that difference you mentioned between basic and the more complex daily tasks, it really highlights how sort of insidious these conditions can be.
Yeah, stroke, again, showed the biggest impact on limiting both ADLs and IADLs. But other NCDs like kidney problems, depression, coronary heart disease, even low back disorder were also strongly linked to limitations in those basic ADLs.
Okay.
And for the IADLs, those complex tasks beyond stroke, having multiple conditions, COPD, depression, they also had significant links. It suggests NCDs might hit those more complex instrumental tasks first, before impacting basic physical needs, maybe as the disease gets worse.
So wrapping this up, given these, frankly, quite profound findings, what's the critical takeaway on how NCDs really impact daily life in Turkey?
Well, in summary, I'd say it's clear that NCDs like stroke, cardiovascular diseases, and, importantly, having multiple conditions, they disproportionately lead to people feeling their health is poor or very poor and facing really significant limitations in their daily activities.
And these findings, they really do underscore an urgent need for action. I mean, not just in Turkey, but globally, right?
Yeah.
Given how widespread NCDs are and this, well, devastating impact on functional independence.
Absolutely. And beyond just telling individuals to manage their risk factors, the study really reinforces the crucial role for society, things like robust social support systems and better home treatment and care services.
Provided by
Local governments, by health institutions. These are essential if we actually want to enhance quality of life and help people maintain their functional independence as they age with these conditions.
So here's something to think about. NCDs are predicted to be among the biggest threats to global public health, right up there with antimicrobial resistance and climate change. So what steps can you, listening now, envision for our own communities? How can we prioritize active living and create supportive environments, especially for our aging populations, to genuinely mitigate these huge health, and let's face it, financial consequences?